Hello everyone, I'm Ying Yao from Dental Designs, and today we'll be going through a series of cases talking about toothaches and why they can happen. So generally, toothaches can happen because of three main overarching reasons, right? So one would be tooth decay, another will be if there's a crack on your tooth, and lastly, it can also be due to gum disease, right? So usually when a patient comes in complaining of a toothache, getting a comprehensive history is very important. Yeah, oftentimes, just by talking to the patient and understanding the nature of their pain, you can often derive an answer as to what the problem already is, right? So usually what I will check for is first where the pain is located, whether or not the pain is localized to that specific area or if it radiates to other areas of their face, whether or not it's the nature of the pain, whether it's a sharp and shooting kind of pain or more of a dull, aching kind of pain. And we'll get to why that is relevant during the cases later, right? So oftentimes also the pain can be transient, as in momentary sensitivity on cold or hot, or it can be lingering, where the pain can last for hours on end, even after they stop, after the stimulus is removed, right? And also, we want to check the severity of the pain, and usually we give a pain score from 0 to 10 to assess that, right? So, yeah, so let's move on to the first case. So, for this particular case, we have an intraoral photo and also an x ray. So, this particular patient came in complaining of pain and biting and a bit of a sensitivity or sharp shooting form of pain on cold or hot liquids, accompanied by pain at night when she was sleeping, right? So based on the checks, you can see that the upper right second molar has a very big filling that has appears to have decay based on visual inspection. And this is where X-rays will really come in handy, because based on the X-ray that we took, you can see that there's a very big decay, and it's shown with by this shadow that you see on the second tooth from the left, right? So, and this X-ray also shows that there's also an accompanying root canal infection on the tooth. So based on this check, we can confidently say that the main cause of a pain is because of tooth decay, right? Yeah, so generally tooth decay, uh, as we mentioned here, patients may generally present with sensitivity to cold or hot liquids or foods. And generally for pain that are more of a decay, because of decay or because of infection of the nerve of the tooth, the pain generally is more sharp and shooting in nature rather than a dull aching kind of pain. So that's why it's relevant. And oftentimes the pain can also radiate from not just the tooth, but it can go up to the forehead, the temple, can cause headaches, right? And usually for patients coming in with toothaches, the main priority of the treatment is for pain relief. And some of the ways that that can be done, firstly, if the decay is not too big and the nerve inside the tooth is not involved, we can do a filling. But otherwise, sometimes if the decay is big enough that it has involved the nerve inside the tooth, then a normal filling may not be enough. And that's when we may need to do a procedure called an emergency pulp extirpation, which is basically going into the infected nerve inside the tooth to remove the bacteria and bring down the infection, which can help to reduce the pain, right? And subsequently, if that is required, this tooth will still need to undergo a root canal treatment as a more definitive treatment, right? Okay, so that's the first kind of first main cause of toothaches, tooth decay, right? So let's move on to the second case over here. Okay, So for this case, you can see that this particular patient came in with a main complaint of occasional sensitivity and pain on biting on harder foods at his lower right area, right? So he says that it's biting when it's pain when he's biting at a specific angle, or if it's a smaller or harder foods and he bites right at a specific spot on the tooth, that's when he'll feel the pain. Right. So oftentimes when patients come in with a complaint of pain on biting, the first thing I would maybe suspect is a cracked tooth, right? And when we looked inside his mouth, we can see that there was indeed a crack on the lower right second molar, right? So you can see over here in this picture, the tooth right at the top, there's a distinct crack line running down the back of the tooth, right? Okay. So yeah, so for cracked teeth wise, usually they come in with a pain or sensitivity on biting, and based on the checks, how we determine if there's a crack, if it's obvious enough just by looking, as in this case, you can see a distinct crack line, but oftentimes the crack may not be that obvious, right? So it may require removal of any fillings that may be present on the tooth to check if there's any underlying crack. It may require a procedure where we shine a light, essentially a trans illumination, to see if we can detect a crack line on the tooth. And sometimes if there's a crack and if it's deep enough, it can result in a localized deeper gum pocket where the crack is. So that can also give us an indication of whether there is a crack and oftentimes how deep the crack may be. Right. So again, usually for the patients coming with pain from a crack, main goal is for pain relief. And how we do that, firstly, if we find that there's a pain when on biting, we can provide a bit of support to the tooth, right? Because pain happens when you bite and the tooth with a crack experiences a wedging force that can widen the crack. So that's where pain normally happens. So to try to relieve this pain, we need to provide some form of support and bracing to the tooth. And how you can do that is with a stainless steel band, or by fabricating a temporary crown to fit it over the tooth, right? And eventually, teeth with cracks will also require crowns, right? So as a more definitive treatment option. And occasionally, for teeth with cracks, they may also require a root canal treatment, right? As the cracks, you can think of it as like a passageway, like in the sense if there's a crack, for bacteria to enter into the nerve of the tooth, causing a infection, which may require a root canal. Right? Okay. Can so now let's move on to, so that's the second possible cause of a toothache, which is a cracked tooth, and now we'll move on to the third case, the last one over here. So this patient came in complaining of a gum swelling on his upper left, right? So normally for patients that come in complaining of a gum swelling, the first thing we think of is gum disease, right? So makes sense, right? So when we look inside his mouth, we can see a very distinct swelling of the gums, as you can see in the photo here, around his upper left second molar, right? So you can see that there's a very distinct puffiness of the gums. The gums around the tooth look a bit swollen, right? And for this particular case, the cause of the gum swelling was also partly contributed by an impacted wisdom tooth. You can see a small part of the wisdom tooth peeking out from behind the tooth, right? So yeah, so for gum disease in general, as compared to, let's say, tooth decay or a crack, the pain generally is more dull and aching in nature rather than sharp and shooting, right? So that's why we also ask about the nature of the pain, right? And generally for gum disease, we'll also need to take an x-ray to assess how severe the gum disease is. So treatment or pain relief methods would be localized deeper gum cleaning around where the gum is swollen, accompanied by some medications like antibiotics or antiseptic mouthwash to help to bring down the swelling and the infection levels, right? And also another very important aspect is to maybe go through the patient about what is their daily oral hygiene or brushing routine like, because sometimes they may not be brushing as well as at that particular area where there's gum swelling. So we may need to reinforce that aspect also. And but occasionally, if the gum swelling is or the gum disease is severe enough, a tooth extraction may be recommended. Right? Okay, so that's basically an overview of generally what's the possible causes of a toothache. So just to recap, firstly is tooth decay. Secondly is because of a cracked tooth, and thirdly is also can be caused by gum disease. All right, thank you.